Dear friends, welcome back. In the previous lessons on pharmacology, we have seen various aspects of drug actions on human body. Now we come to integrating these ideas where allopathy meets homeopathy. Homeopathy is just an extension of allopathic knowledge of drugs, human anatomy, physiology, pathology, and disease. Only its philosophy of viewing disease and health is different, which we have seen in some previous lessons. We shall now see how we can integrate these ideas when it comes to pharmacology. The different strands that we saw in the lessons on pharmacology were polypharmacy, that means using two or more medications on every patient. The paradoxical action of drugs, which was the drugs having the opposite effect of what they were meant to do, like a pain remedy causing pain. Then we saw idiosyncratic reactions, or the IDRs, which happen after the drug is stopped, but we get certain adverse reactions. We also discussed very briefly about narrative medicine, where the patient tells the story, and that gives us an insight into the person's mind, the causation, and what is the patient's idea about his disease. We also learned the importance of placebo action and how it can be harnessed in homeopathy. We shall also be taking a look at epidemics later, because that will be an integration of all these ideas together. Polypharmacy, as you know, is taking plenty of drugs by one single patient. As you might already be knowing, that an average elderly person is taking anywhere between 6 and 7 medications 3 times a day. They have been prescribed very often by different doctors for different ailments. Wouldn't it be really wonderful if we could have a single remedy to cover the entire totality of symptoms? And I don't mean this. It won't be an atom bomb sized pill, but instead we shall be having one single homeopathic remedy which exhibits all the symptoms which the patient is having. This brings us to the concept of totality. In homeopathy, every single symptom is part of a composite whole, and our aim is to discover a single remedy which will cover the entire spectrum of symptoms. That might seem like a fantasy, but the fact of the matter is homeopathy has been dealing with cases on this concept for the last 250 years with tremendous success. And that success is not limited to chronic ailments only, for which allopathy has little or nothing to offer, but also in the case of acute diseases and also in epidemics. The concept of totality takes into consideration the seat of the disease, the cause of the ailment or symptoms, the changes in temperament that have been brought about in the personality of the patient, any peculiarities. For instance, a patient who is having chills desires cold water in large quantities, which is quite contrary, apparently. We also take into consideration for the totality what we call as modalities. Modalities are those factors which change the intensity of the symptoms, things that make a person feel better or worse. It could be a time modality, for instance, pain in the night is more, or it could be posture, and so many other things which we saw in an earlier lesson. And importantly, any concomitants, which means any other complaint or symptom which the patient reports in addition to the chief complaint. The concept of totality will be best understood by taking a particular case. This is the case of a person who is 35 years old, who is an executive in a multinational company. He has been complaining of pain in the right deltoid region. He has been to physiotherapists and a couple of other places to find relief. He has taken non-steroidal anti-inflammatory medications, painkillers, but the pain in the right deltoid region is persisting. As a matter of fact, he is often sleepless due to pain. Anytime he makes a movement of his arm, the pain is worse. Also, on further questioning and asking the details of the pain and its characteristics, he tells us that the pain is extending downwards along the arm from the deltoid region. He is particularly better between 6 to 9 p.m. after sunset. And when we were using the patient's narrative, we find that he reports that it all started after he suffered an embarrassment in an office meeting. He was not prepared for the set of questions asked, and he felt as if he was deeply embarrassed by his failure. He also reports that he gets palpitations in the heart anytime that he is anxious. All of you are qualified medical graduates, medical practitioners from different streams, and you'll have medicines to address each one of these complaints separately. We are dealing with just 7 very general symptoms reported by the patient. We shall be learning more about this when we come to the actual nitty-gritty of case taking. But for now, we are having a patient who comes to us with these 7 complaints. We can explain how homeopathy works in the selection of the remedy by considering a Venn diagram with 7 circles representing the 7 different symptoms. So we have to take the intersection of these 7 and find a remedy that covers all of these. So as you'll see, these 7 circles overlap, and there is one place where all 7 of them intersect. This is a very brief and simplistic explanation of the whole process of remedy selection, but it is quite representative of what we are going to do next. Using a homeopathic software, we do a quick analysis of all these symptoms, and we find that there is one remedy that fits all the 7 symptoms, and that happens to be this remedy. At this stage, don't worry about the numbers. They describe the intensity and the grade of symptomatology, but for now we are not concerned with that. So you will find that this particular remedy, Calmia latifolia, is best indicated. This patient did quite well on that, and after 2 weeks he reported that not only had his pain gone down, he did not suffer from any palpitations in case he was anxious, and as far as the embarrassment part is concerned, he was not bothered with that anymore. That brings us to the end of this lesson. Thank you very much. This lesson was directed to one objective, and that was you will be bringing in all your knowledge of anatomy, physiology, pathology, disease, as well as all the ideas that you learned in medical school about pharmacology. And now we are in a position to understand the common meeting ground. Of course, the larger purpose of any medical practice is the benefit of the patient, to relieve the person from suffering. And there can be no higher purpose in life of a medical practitioner if we can achieve that purpose. So thank you very much, and bye-bye.